Welcome back. You're tuned into Radio Azad 107.9 FM SG4. सुन रहे हैं आप दमदार दिलदार show. But before we go any further, we do have our special guest. I want to bring in Rob. And Rob is actually joining us today. He's a forward-thinking innovator in the healthcare space and a key voice behind ProactiveWellness Care. If you ever wondered how this modern technology is changing the way we look at our health, Rob is the perfect person to ask this. His work at ProactiveWellness Care bridges the gaps between doctors and patients and using real-time remote monitoring to keep people healthier, manage chronic conditions, and keep them out of the ER. Rob, welcome to the show.
Thank you, Gautam. Pleasure to be here. Appreciate the opportunity to talk with with all your listeners.
Absolutely. Rob, the website, the name of your website says it all. Proactive Wellness Care. And I wanted to ask this question to you. Why is our current healthcare system so reactive? And how is ProactiveWellnessCare.com changing that?
Gautam, that's an interesting question. I feel part of it is just the tradition and the culture, how we've been brought up, right?
Right.
People often pay for care after they get sick, not for keeping healthy. Providers are also overloaded, data is fragmented, and patients tend to fall through the cracks in between their visits to their primary care doctors. So to become proactive in healthcare, the whole system needs better monitoring, earlier intervention, and strong support from outside of the clinic walls. And that's kind of where we come in. We try to help the physicians that are out in our community help manage a lot of their patients on a routine day in, day out basis when they're not there to see them.
Right. And that's when, it's kind of it says proactive. This is where the monitoring part comes in. So for anyone listening who has never heard of remote patient monitoring, can you paint a picture of how it actually works for a normal patient at home?
That's a great question. One of the things that you can expect with the types of services that we offer is we partner with the physician practices out in the community. So patient sees their doctor or their nurse practitioner. They get evaluated for a new concern, a new symptom. Let's say they're starting to develop symptoms of high blood pressure. They give them new medications. They give them instructions. They go home. They may have challenges taking them. They may have side effects that they think, it's not supposed to make me feel this way. And then many times they don't say anything. So next thing you know, they've gone out a month, 2 months. Mm-hmm. They're to be back to their doctor's office in sometimes 3 months, sometimes 6 months. So there's a lot that happens in between those two office visits, right? So if you can think about if you've got older parents, for example, how is mom and dad handling their chronic condition? Don't you wish someone was there to have a safety net, right? To support and be a backup to their providers? That's the type of service that we offer, right? So in many circumstances, most of the time, we'll give our patients a blood pressure device, for example, or a blood glucose monitor. These patients take it home. They're managing their blood pressure on a daily basis. We have nurses that get this data on a day in, day out basis, and they're monitoring. They're monitoring for trends, high spikes, low spikes. They're calling the patients. They tend to understand the patient almost near real time, how they're doing. Are they experiencing side effects? Are they taking their medications as prescribed? Sometimes they don't take them as prescribed, and that's where they see some of these pitfalls. So we give them ongoing education that I can almost guarantee their providers, their doctors, and their healthcare staff gave them that information, but they go home, back to reality, and they forget, or they didn't understand. So that's where our clinical care team comes in, and they'll help support and bridge that gap from when the patient leaves their office, goes home, and then from that point, in between their office visits, and now they can go back to their doctor's office with more data and a better fundamental understanding of their condition.
Right, you absolutely hit the nail on the head where it says, all these conditions that you're talking about, high blood pressure, diabetes, and heart health, they are massive topics in our community. And I just wanted to ask you a quick story or an example of how catching these numbers early on has saved someone a stressful trip to the ER.
You know, you know what the nickname is for high blood pressure, right? For hypertension, it's the silent killer.
You're right.
You can look healthy on the outside, thin, slender. You could be having high blood pressure behind the scenes without understanding how you're doing. It could be a ticking time bomb, and that can be what? It can be a cause for a stroke. It can be a cause for an MI, a heart attack. So having that vital sign and that trend ongoing and being overlooked at by clinical staff day in, day out, your physicians just don't have the time. They don't have the bandwidth to do that.
Right.
So we encourage our physicians to give us the opportunity to partner with you. Give us that opportunity to help you in between visits and help your patients. And what tends to happen, Gotham, is we see a tighter bond between the patients and their providers, and a greater sense of care that they experience. And we've gotten a lot of positive feedback from them. And not only that, but also from the patient's family and caretakers. So our service extends beyond just, following the doctor's orders. It really helps that personal touch point that, sometimes our society just needs. It just needs someone to listen and be a support as well.
Absolutely. And this is such an eye-opening conversation. Amazing to see how technology is putting power back into the hand of patients and their families. Rob,
Yes.
Thank you so much for joining us today on Radio Azad and sharing how you're changing the healthcare game. So if you or your loved one want more or learn more about proactive health tracking and remote patient care, make sure to visit ProactiveWellnessCare.com. Rob, I appreciate your time. And
it was my pleasure. Thank you,
Keep up
Gotham,
the
for the
fantastic
opportunity.
work. Absolutely.
Thank you very much.
Thank you again.
Thank you, my friend.
Take care. All right, there you have, ladies and gentlemen, Rob from ProactiveWellnessCare.com. And this is, again, a great initiative where they have managing patients with hypertension, diabetes. And what they do is they do a remote patient monitoring. And this is where it kind of changes the game. All you need to do is get in touch. If there's physicians that are listening to this broadcast, do call in Proactive Wellness today at 972-327-3687. Or you can also check out online. The website is ProactiveWellnessCare.com.